Yes, hello. I just had delivered in my inbox the latest government paper on mental health. It's called No Health Without Mental Health. And yes, it's very positive piece of paperwork. And apparently, they're bringing out the disability officers, which they had under Margaret Thatcher's government. Disability officers to help disabled people, including people with mental health problems, back to work. But they still seem to be in favour of early intervention. Now, it's a psychiatric department that disables people from working. Despite being diagnosed with mental health problems, I clung to employment for years. I managed to stay in employment despite the best efforts of the psychiatric department to make me unemployable. Um, the government is taking too much heed of what psychiatrists and psychiatric nurses are saying, because they want everybody disabled on the sick pay once they've diagnosed them with something. As soon as the Labour government passed a bill that gave psychiatrists all the power they wanted, I was forced to give up employment so that the psychiatric staff could make sure the medication's going in. And that's all they care about, that the medication's going in. Now, I have been on this medication. They only have one type of medication, that's the antipsychotic, that is supposed to cure everything that is not a mood disorder. It doesn't. It doesn't cure everything. It just makes you very ill. I don't think I'll ever recover from the treatment I've received from the psychiatric department. These medications are extremely dangerous and cause all sorts of long-term problems once you put on them. And they don't help at all with being psychic. That's what they seem to object to, the fact that I'm psychic. It doesn't help. It's just disabled me from working. And the government's intentions may be very good. They're employing disability officers again at the job centre, and they're apparently bringing out courses that are not just therapy for mental health patients. Doctors only want mental health patients to engage in therapeutic activities, but the government is bringing out some sort of course that will actually teach mental health patients new skills that they can use in the workplace, which is good. But these doctors will never agree to it. They will not sign you back to work for anything other than therapeutic reasons. So, in order for these changes to take effect, you need to reword the Mental Health Act. As far as these psychiatrists are concerned, they can now section anybody who refuses treatment, or who refuses to let the psychiatric nurses in, or if you're out when the psychiatric nurses visit because you've got a job, they can section you because you're not complying with treatment. They can, because it says in the Mental Health Act that you can section people for their own health, safety, and other people's safety. So now the psychiatrists think that if you're not complying with every aspect of treatment, you're a danger to your own health, and they have you sectioned. Now, you need to reword the Mental Health Act that people cannot be sectioned unless they have actually caused serious harm to another person. I don't agree that these psychiatrists can tell into the future when somebody's going to harm somebody else. They can't. They should reword. If people commit, I'm not sure whether I actually believe in euthanasia, but if people, are unhappy and they try to kill themselves, I don't think it helps them locking them up in hospital for months. the government is talking about more psychological therapies, which is good. And it was also praising a health authority that had reduced the number of patients on antipsychotics. But, you know, will psychiatrists agree to this? You have to change the law, the wording of the Mental Health Act, before these changes can be implemented, because psychiatrists and psychiatric nurses want everybody disabled and dependent on them once they've had them diagnosed. Yes, a step in the right direction, Mr. Cameron, but you know, you need to change the wording of the Mental Health Act, that people cannot be sectioned unless they've actually caused harm to another person. Bye.